Welcome, welcome. I'm so excited you're here for this Myo Minute. My name's Carmen. I am a myofunctional therapist and I'm also an educator. So by now, you probably have maybe seen one of my other videos, which I absolutely love because I take that role very, very seriously. Today in this Myo Minute, I'm going to be talking with you about the comprehensive myofunctional exam. So I'm going to talk about the what and the why, because really the myofunctional therapy is the how. So let's dive in. First, let's talk about what this exam accomplishes for the client. So when I do a comprehensive exam, my goal is that I'm going to answer their questions and connect the symptoms and the impairment so that they completely understand. This takes more time and effort for some clients, and other clients it really makes sense right away for them. Now, this also accomplishes something for the therapist, meaning me. So I am looking for information that identifies the myofunctional impairment, but I also use this to plan therapy, what this person needs. So it helps me determine what they need, what level of therapy they need, and really if they're going to be an easy or a difficult client. Next, this might help the provider understand the patient as well. So, in an ideal situation, my clients will see somebody who understands myofunctional impairment, who understands the importance of myofunctional therapy. But let's face it, I don't get to pick everybody's dream team. So in this case, when I'm thinking about, or the clients that I'm thinking of, they take this report that I write after a comprehensive exam and they may take it to their provider, the person that they feel is their go-to person for a frenectomy. Now, I've had several cases where that dentist, going by the textbook of, only releasing a tongue tie if, ... When my clients give the provider this report, it really explains to the provider what that snapshot of myofunctional impairment looks like. So when that doctor might be saying, well, I don't feel like you need a frenectomy, when they read my report, they understand that. Now, that's not to say I like it when that happens, because really I feel like if my clients have to talk their provider into doing the procedure, then I would love it if they saw somebody else. But again, I don't always get to give that feedback. So that's where my report and thus that comprehensive exam helps the provider. And then also in the case of somebody with a severe tie, the report for the provider might give them a little bit more insight. For example, I do work with some providers that won't do a frenectomy until a client is at a certain level and can do certain things. And that means starting therapy ahead of schedule by generally a month or 6 weeks. But some clients of mine who have such a severe tie, there's only so much that we can get done prior to that frenectomy. And so when I do a comprehensive exam and I put this in my report, that's very valuable information for that provider, because this client isn't going to be able to master certain things because we have to get that tongue released before we can start. So last, let me answer the big question everybody always wonders, like, Carmen, I know I need therapy. Why do I have to have an exam? So first, we have to identify the impairment. I'm very stubborn in my practice that I make my clients understand where they have concerns, how they connect, and why they need therapy. Unfortunately, I choose not to work with somebody if they don't believe that they need the therapy. I have many people who have the money and the time and they're willing to do it, but they don't understand why they need the therapy. And I can't choose to work with them because it's not going to be successful and I'm going to dread seeing them every time. So this exam helps you, the client, understand the impairment and why you need the therapy. Next, it also helps identify a tongue tie. Now, I totally get it. Some tongue ties are obvious, okay? And I say this all the time. We don't diagnose based on a picture. Now, some people, I get that. we don't have to do anything else because we can see that there's a tie. But some people, it's not that obvious, and they can't identify the functional deficits if they have not had a comprehensive exam. So that's why it's important. And I'm pretty sure that is the most valuable information building step in the whole process. So that explains to you the what and the why of the myofunctional exam. Now, today over in my Facebook Live, I'm going to be talking about what you should learn from your comprehensive exam. So I'm going to dive a little bit deeper. You can catch me over there on my Facebook page at The Tongue Trainer. I'm there every Wednesday at 11:30 Mountain Standard Time, and I'm going to be digging a little bit deeper into that information. The other thing is, if you haven't gotten your free assessment tool, the quick assessment tool that you can sign up to get at the bottom of any one of my blogs is your friend. This is a great place for you to jump off into exploring myofunctional therapy. I love this tool because oftentimes it facilitates a conversation between me and you. And when somebody schedules a free 30-minute assessment with me, they're able to come to the table with some information. They can say, hey, Carmen, this is what I found out. What do I do for my next step? The next step is always going to be a comprehensive exam with me, but I love those free 30-minute assessments because we can talk about if it makes sense for you to pay to have a comprehensive exam. Plus, it gives us a chance to meet each other and make sure that there is that trust, that comfortableness that comes, that has to be there to do myofunctional therapy, or else we both regret it and it's never successful. So if you haven't gotten that, like I said, you can get that at the bottom of any one of my blogs. So I will see you next week in the Myo Minute, or I'll see you over at the Facebook Live at The Tongue Trainer, and I'll be there just shortly. Bye for now.